Now, Dr. Marty, yesterday we heard Dr. Anthony Fauci speaking about the dangers of reopening too much and too fast. What is your assessment to our local mayor's plans to relax certain restrictions?
Well, I've had the pleasure of speaking to Mayor Jimenez, being among the task force members for several of these task forces for several of the groups, and have also worked with Mayor Suarez, Mayor Gilbert, many other mayors throughout the Miami-Dade County. We're looking at very tight restrictions. If you go through those guidelines, you'll see that they're very, very carefully thought out. Now, saying that, you're absolutely right, and Dr. Fauci is right. There is a risk, and the country is still at the plateau, and therefore, we are really hoping that the public does exactly what Mayor Jimenez says, which is take personal responsibilities and adhere to the guidelines. And if we do that, then we can have a semblance of normalcy in having some kind of reopening for our city. But yes, there is a concern, and the concern is largely, will there be a super spreader that spoils everything in one area? And this is why we also have something in place in many of the different organizations that we're opening up, where where there has to be a group that evaluates what happened the day before and what's happening now with their employees and with their customers, whatever type of customer they have or guests, so that they know every day where they are and whether or not they're meeting the guidelines. They are also going to have checklists that they have to fill out to see if they are in compliance with the particular guidelines for their particular type of business.
Dr. Marty, I'm curious, do you personally plan to go to restaurants and other types of businesses that will be opening up?
I will be looking very carefully at the various restaurants. I will be looking to see if they are in compliance with the various rules that we've put in place. I've actually gone to several restaurants, not to eat, but to see what they have in place. For example, I went to Joe's and looked at the kitchen and saw how they were staffing it. They were very, very kind in how they let me look around and make sure that they had good plans in place. And a place that has good plans in place and is following the rules, and I as a customer follow the rules, I think that it will be an okay thing to do is to go ahead and eat at one of these restaurants.
Dr. Marty, in the beginning of all of this, we were hearing that maybe children weren't as vulnerable to COVID-19. And now we're learning about this new inflammatory illness among children that is deadly and could actually be linked to the virus. What do we know about this new fear, and how much should it actually be factored into those discussions about reopening? Well,
that's it. Kawasaki's disease is basically what they're manifesting. And we call it that, even though it isn't a specific disease. What it is a reaction that certain children have to a number of different viral illnesses. And it involves particular cells, monocytes and plasma cells in particular, that respond oddly to these viruses. And curiously, Kawasaki's, what we're seeing in the children, is actually not that different from some of the kinds of cells that are involved with some of the complications we're seeing in adults. So it's the children's manifestation of a particular kind of immune reaction that we know can happen with a set of viral illnesses. And we had seen before with other coronal viruses could cause this Kawasaki syndrome. What makes it a particularly serious thing, this kind of reaction, is that it causes inflammation of blood vessels. And among the blood vessels that get inflamed are the blood vessels of the heart, the coronary arteries. And this can, if the child is not promptly treated, be extremely serious. So it is a very serious condition, but if the child is taken to hospital promptly, as soon as we start seeing some of the manifestations, we do have good therapy for it. And generally speaking, if the child arrives in hospital early, they will do very well, even though they have this horrific vasculitis that has a lot of particular features that we see with it.
And Dr. Marty, at least one company, Inovio Pharmaceuticals, they say they're making progress on a vaccine and that they actually plan to scale up their production and have vaccines ready for frontline workers. What can you tell us about that and where we are on the vaccine front?
There's about 90 different vaccines that are being looked at in different countries and different labs, many in conjunction with one another. Of those, about 9 of them right now are in various stages of clinical trials, and that is one of the vaccines that's being looked at. We're very glad that there's many possibilities out there, but they need to be tested, tried, proven to be safe. We need to figure out exactly what the dose is that's most effective. We need to figure out what level of protection it gives, and we absolutely have to be sure that it does not cause any significant side effects. And to get all that information takes quite a bit of time. One of the things that has recently been authorized is challenge trials in humans, something that's really quite an unusual thing to do. A challenge trial means you would give someone a trial vaccine that's already been demonstrated to produce antibodies that are neutralizing and already been in humans and already shown to be safe in humans. And now you would expose that person who's developed the antibodies to the wild virus. This is quite a remarkable thing that's being authorized because we don't usually do that for a deadly disease. But the urgency of creating a good vaccine has led international organizations to produce such a document to allow for challenge trials.
It's amazing how all this research is being sped up and everybody, the whole world is watching it. Dr. Aileen Marty from Florida International University, thank you so much for your insight.
Thank you, Dr. Marty.